Good day everyone. I am Dr. Srinath, consultant neurosurgeon at Renova Hospital, Kompally. Today I am in front of you to speak on the topic of head injury. So head injury, most of us have encountered through our friends or family where they have had a head injury, either a mild or a moderate one. And sometimes we see in the news that so and so accidents have happened. The most important result of these accidents usually that we should be concerned with is a neurological injury such as a head injury or a spine injury. When coming to the head injury, most of the head injuries are supposed to be minor to mild injury only. Around 90% of these injuries are only mild to injuries, whereas around 5 to 6% are moderate injuries which require observation and hospitalization, whereas less than 5% of these injuries are severe injuries requiring surgeries and a prolonged hospital stay, ICU stay, and also a prolonged recovery and rehabilitation. When we come to the minor type of head injuries, usually bumps and hits onto the head are common occurrences in the household and also in the daily professional activities. So any such injuries which have a minor injury such as a skin bump or anything without any loss of consciousness or giddiness or any vomiting sensations are considered minor injuries, which are usually treated with symptoms according to the symptoms of pain and swelling with painkillers and rest for a period of 4 to 5 days. If the injury is a little more severe, the patient usually experiences a loss of consciousness, drowsiness, or a loss of awareness or decrease in awareness with a few vomitings or giddiness. So these minor symptoms are usually called concussion of the brain or minor concussive head injury. This usually requires observation at home or at best in a hospital for a period of 24 to 48 hours, and symptomatic treatment is the best option. And if after 24 to 48 hours of observation the patient does not have any new symptoms, she is usually discharged to home with advised medication and rest. In certain severe cases where the symptoms are more prolonged and severe, the patient has to undergo investigations such as CT scan or MRI of the brain to rule out injuries to the brain such as bleeding inside the brain, fracture of the skull, and so on. So in patients who have shown bleeding of the brain or fracture of the skull on CT scan, they are compulsory to be admitted and observed for a minimum of 24 to 48 hours, depending on the size of the bleed. If the size of the bleed is minor, the patient is only observed with medical management. And if the size of the bleed is more, the patient has to undergo surgery to remove the bleed. Usually, when the size of the bleed is more, the severity of the head injury is more, and the patient has to undergo an emergency surgery. We commonly encounter three types of bleeding in the brain, such as the extradural hematoma, the subdural hematoma, or the intracerebral hematoma. In the extradural hematoma, the bleeding is on the surface of the brain or over the covering of the brain, where the bleeding is putting pressure on the brain, and if the bleed size is more, it has to be emergency evacuated immediately. It is usually followed by a full recovery. In the next type of bleed called the subdural hematoma, the bleeding is inside the covering of the brain and between the covering and the brain, and it is the most severe type of bleeding, which is a surgical emergency depending on the size. And if the patient is in a poor neurological status, the surgery has to be an immediate procedure by removing the bleed and allowing the brain to relax with the providing of relief from edema. The procedure is usually called a craniotomy and sometimes called a decompressive craniotomy. And the patient usually has a long period of recovery with a prolonged ICU stay followed by recovery in ward and rehabilitation. Sometimes the bleed is inside the brain, that is within the matter of the brain. If the bleeding size is more, even this has to be an emergency and has to be removed immediately for the best result. Usually, patients with subdural and intercerebral hematomas usually have the possibility of having seizures or epilepsy in the later part of their recovery as well as later part of their lives, and therefore have to be under adequate and appropriate medication for the exact duration advised by your surgeon. So in these patients who have been operated, the postoperative period in ICU is very critical with maintenance of airway, breathing and circulation, and allowing the brain a sufficient amount of time to recover, and taking all measures to prevent infections and as well as prevent complications of the ICU stay. The period of ICU stay, if uneventful and the patient has recovered, the patient is shifted to ward for immediate post-op rehabilitation in the form of nutritional rehabilitation, physical rehabilitation, and if the patient has successfully weathered this condition and in the state of discharge can be discharged, he is usually advised to go to a rehabilitation center for an extensive period of rehabilitation physical, occupational, speech, as well as psychiatric rehabilitation. So, in order to have a full recovery, most of the patient, if they undergo such therapeutic actions, they have a near normal recovery. Only in the most severe of these head injuries, the patient is bedridden for the rest of his life and has to be taken care of by another person, so that most of the complications such as infections are avoided in the recovery period. If the patient follows the doctor's advice adequately and follows up with the doctor regularly, most of the patients have an uneventful life recovery and also can go back to their normal life. Thank you.